You know that awful cycle, right? The constant scratching, those red, angry patches on your pet's skin, maybe flaky spots that they just won't clear up. It's so tough watching them go through it.
Absolutely. It's one of the things we see, gosh, probably most often. And it's incredibly frustrating for everyone involved.
Well, today we're going to do a deep dive into what's very often behind those stubborn skin problems.
Hmm.
Pyoderma. We've been digging into the veterinary sources, the textbooks, the research, trying to pull out the real need-to-know stuff on diagnosis and treatment.
Right. And our mission really is to cut through some of that technical jargon for you.
Yeah.
We want to explain what pyoderma actually is, why it happens, and maybe the most crucial part, why does it keep coming back for some poor pets?
Yeah, let's unpack that recurrence issue. I think you'll find some of what the sources emphasize pretty surprising.
Definitely. Where should we start?
Let's just jump right in. So first things first, what exactly is pyoderma? Keep it simple for us.
Okay, simple. At its core, the sources all agree. It's a bacterial infection of the skin.
A bacterial infection. Got it. But reading through the material, it seems like it's not just one monolithic thing. There are different levels, almost.
Exactly. Yeah, that's a key distinction the texts make. They classify it based on how deep the infection actually goes into the skin layers.
Okay.
So you've got surface infections. These are literally just on the very, very top. Think hot spots, that acute moist dermatitis.
Oh, right. Where they lick or chew one spot raw and it flares up really fast.
Uh-huh. That's surface. Then you step down to superficial pyoderma. This involves the epidermis, that's the main outer skin layer, and the hair follicles. But importantly, the follicles themselves are still intact.
Okay, so a bit deeper, but still kind of contained.
Pretty much. And this is where you might see things like mucocutaneous pyoderma affecting those areas where skin meets moist tissues like around the lips or nose.
All right. Surface, superficial. What's next?
Then you get to deep pyoderma, and this is the serious one. The infection goes right down into the dermis, that thicker layer underneath, sometimes even deeper into the underlying tissues. Wow.
And often it involves something called furunculosis. That means the hair follicle actually bursts open deep down.
Ooh, that sounds painful.
It is. And here's the really concerning part the sources highlight. With deep pyoderma, pets can actually become systemically unwell. Fever, lethargy, not just a skin problem anymore.
Okay, so the depth really dictates the severity. Surface, superficial, and then deep, which can affect the whole body. Right. So let's dig into the why. Why does skin, which, has bacteria living on it normally, suddenly get infected like this? What goes wrong?
Yeah, that's really the heart of the matter, isn't it? And the sources are quite clear. The bacteria only really cause trouble when the skin's natural defenses are somehow compromised.
Compromised how?
Well, several ways. The skin barrier could be physically broken, maybe from scratching, a wound, even just friction. Or if the skin stays wet for too long, they call it macerated, that lets bacteria multiply like crazy.
Okay, so damage or too much moisture. Makes sense. Right. Also, changes in the normal balance of bacteria on the skin, poor blood supply to an area, or, and this is a really big one, the texts emphasize a weakened or suppressed immune system in the patient.
So it's less about the bacteria just being there and more about the skin not being strong enough to keep them in check.
Precisely. And this leads to probably the single most critical point the sources hammer home about pyoderma, something that maybe isn't always obvious up front.
What's that?
Pyoderma is almost always secondary.
Secondary. Meaning?
Meaning it's not the primary disease itself. It's a consequence, a symptom of some other underlying problem that has messed up the skin's defenses. The infection is just taking advantage of this situation.
Oh, that's huge. So the skin infection is like a big flashing warning sign saying, look deeper.
Exactly. You've got to find the root cause.
So what are the usual suspects? What underlying causes do the sources point to most often?
Well, the list is pretty long, which is why it can feel like detective work sometimes. Allergies are absolutely massive. We're talking flea allergies, environmental allergies, pollens, dust mites, molds, what vets call apopy food allergies, even contact allergies to things they touch.
Okay, allergies make intuitive sense. They cause bitching, the pet scratches, breaks the skin, boom, infection.
You got it. Then there are parasites. And the sources specifically call out Demodex mites as a really common trigger.
Demodex. Those are the ones that live in the hair follicles.
Yeah, especially in young animals or ones with weaker immune systems. Fungal infections, like ringworm, can also damage the skin and let bacteria move in.
Okay, allergies, parasites, fungus. What else?
Endocrine diseases, so hormonal imbalances. Things like hypothyroidism, where the thyroid gland isn't active enough, or Cushing's disease, where there's too much cortisol. These are surprisingly frequent underlying causes, the sources mention.
Wait, hormonal problems can lead to skin infections. How does that work? Seems less direct.
It does, but the sources explain that these conditions can directly affect the skin's health. They can make it thinner, change the hair growth cycle, and crucially, they can suppress the skin's local immune function. Makes it way easier for bacteria to overgrow.
Wow. Okay.
Yeah.
That's important to know. Any others?
Yep. Just general immunosuppression, maybe from another serious illness, or sometimes even from medications like corticosteroids that might be needed for other reasons. And then there's sort of structural issues.
Structural, like how the pet is built.
Exactly. Think breeds with lots of skin folds, bulldogs, Sharpies. Those folds trap moisture and heat, creating a perfect little bacterial incubator. Even just having a short coat that doesn't protect the skin well, or friction in certain areas.
So skin folds are a risk factor.
Definitely. And finally, just plain old physical trauma, chronic scratching, lying on hard surfaces causing pressure sores, or even things like embedded grass seeds or splinters breaking the skin barrier.
Gosh, there's a huge range of possibilities, from fleas to hormones to skin folds, and the main bacteria causing all this trouble. Is it usually the same one?
In dogs, overwhelmingly, the sources say it's Staphylococcus pseudointermedius. That's the big one. In cats, it's less common overall, but when they do get it, Pasteurella multisida is often involved.
Okay.
For those really deep infections, or ones that keep coming back, sometimes you find other bacteria too, including some trickier gram-negative ones.
Right. So who is most likely to get this? Is it fair game for any pet?
Well, the sources are very clear. This is predominantly a dog problem. It's super common in dogs, but interestingly, quite uncommon in cats.
Really? Why the difference, do they say?
They don't delve too deeply into the why in the text we looked at, but it's a well-recognized difference. Maybe grooming habits, skin structure. Hard to say for sure. As for who gets it, it affects males, females, neutered, intact, pretty much equally.
Any particular breeds that the sources flag as being more prone, besides the wrinkly ones?
Yes, definitely. But those short-coated breeds with folds are high risk, as we said, bulldogs, pugs, basset hounds, etc. But the sources also specifically call out German Shepherd dogs.
German Shepherds, why them?
They seem particularly prone to developing really severe deep pyoderma, often involving the immune system, and unfortunately, it tends to relapse frequently in the breed. It's a known issue.
Huh, that's really interesting. And what about age? Does pyoderma tend to start at a certain age?
It often gives you clues about the underlying cause. For instance, if a puppy develops pyoderma, you might think more strongly about Demodex mites or perhaps the early onset of environmental allergies at a puppy. If it starts in a middle-aged or older dog for the first time, endocrine diseases like hypothyroidism or Cushing's jump higher up the list of possibilities.
Gotcha. So the age can help narrow down that long list of potential causes. Okay, we know what it is, why it happens. What does it actually look like? What are the signs you might see on your pet?
Yeah, the appearance really depends on whether it's superficial or deep. Superficial pyoderma often shows up on the trunk, the main body, and sometimes, especially in longer-haired dogs, it can be kind of hidden. You might have to part the fur to really see what's going on.
So you might just notice them being itchy, but the lesions themselves are subtle. Maybe some redness or small bumps.
Exactly. Or maybe some scaling or hair loss. Deep pyoderma, though, tends to favor certain locations. The chin acne is often deep pyoderma. The bridge of the nose, pressure points like the elbows or hocks, and the feet between the toes are common spots.
Okay, specific locations for deep stuff.
Right. And deep pyoderma can also become much more widespread. And like we mentioned, you might see those systemic signs, the pet acting sick, maybe having a fever, being painful.
And does it usually pop up suddenly, or is it more gradual?
Could be either, really. Sometimes it's super acute, like a hot spot that blows up overnight. Other times it's a more slow, smoldering, chronic thing that builds up.
What about itching? Is it always itchy?
Usually, yes. Pruritus, that's the technical term for itching, is typical. Now, is that itch from the underlying allergy, or is it the infection itself causing itch? Often both. But here's a key point the sources make. In some cases, particularly if the underlying cause is something like Cushing's disease, where there's naturally high steroid levels, the itching might actually be minimal or even absent.
Oh, wow. So no itching doesn't automatically rule out pyoderma. That's important.
Very important. It can be misleading.
So when a vet examines a pet, what are the specific things they're looking for? What are the telltale signs?
Okay, so the primary lesions, the initial things that pop up, the Absolute classics, according to the sources, are papules and pustules.
Papules are small bumps, pustules are.
Pustules are those little bumps filled with pus-think tiny pimples. Seeing pustules is highly, highly suggestive of a bacterial skin infection. In really severe, deep cases, you might even see something called hemorrhagic bullae. Those are larger, blood-filled blisters.
Yikes. Okay, papules and pustules are key early signs. What happens as those lesions develop or heal? What secondary signs appear?
Right, so as things evolve, you see other changes. Those pustules might rupture and dry up, leaving crusted papules or larger areas of crusting. And a really, really strong clue for superficial pyoderma that the sources emphasize are epidermal collarettes.
Epidermal collarettes. What are those?
They're these characteristic circular rings of scale or peeling skin. They form when a pustule or maybe a small blister pops, and the roof lifts off and dries, leaving this little circular edge. Seeing those is almost diagnostic for superficial bacterial infection.
Okay, collarettes, good clue. What else?
You'll often see hair loss, alopecia. Sometimes it's packy, kind of moth-eaten looking. Scaling, obviously. If it's been going on a while, the skin can get thickened and leathery. That's called like enification. You might see target-shaped lesions, sometimes abscesses, those ruptured follicles or furunculosis we talked about with deep pyoderma, and even spreading inflammation in the tissues called cellulitis. It's quite a spectrum.
Definitely sounds like it can look very different depending on the stage and depth. So, faced with all this, how does a veterinarian actually nail the diagnosis? And maybe more importantly, how do they start figuring out that crucial underlying cause?
Well, the diagnosis of pyoderma itself often starts just by recognizing those characteristic lesions we just talked about, especially the pustules and the collarettes. But you really need to confirm it and then absolutely start the hunt for the why.
What are the go-to diagnostic tests then?
Cytology is usually step one. It's quick, it's cheap, and it gives you answers right away.
That's where you take a sample and look under the microscope.
Exactly. You can press a microscope slide directly onto a pustule, or maybe lift up a crust and swab underneath, stain it, and take a look. If you see inflammatory cells, particularly neutrophils, with bacteria inside them, intracellular bacteria, that confirms you've got an active infection happening right there.
Okay, so cytology confirms the bacteria are causing trouble. What else is essential early on?
Skin scrapings. The sources are adamant about this.
Yep.
You absolutely have to do skin scrapings to look for Demodex mites.
Because there's such a common underlying cause, right?
Precisely. If you miss the Demodex, you can treat the bacteria all day long, but the pyoderma will just keep coming back because the mites are still driving the problem.
Makes sense.
Oh.
So cytology, skin scrapings. What about when things are more complicated, like if it keeps returning or isn't responding?
That's when bacterial culture and sensitivity testing becomes really crucial, especially for recurrent cases, infections that aren't clearing up with standard antibiotics or any deep pyoderma.
And that tells you.
It tells you exactly which species of bacteria is growing and, most importantly, which specific antibiotics will actually kill it. It tests the bacteria against a panel of drugs. The sources also mention sample quality matters here. Getting a sample from an intact, unopened pustule is best. Or for deep infections, sometimes a small tissue biopsy for culture is better than just swabbing draining gunk.
Right. You want the real culprit, not just surface stuff. But okay, that diagnoses the infection. Finding the underlying cause still seems like the major hurdle.
It absolutely is. That's where the real detective work comes in, and it depends on what the vet suspects based on the history, the signs, the age, all that.
So what kind of tests are involved there?
Could be a range of things. Maybe a fungal culture, often called a DTM, to rule out ringworm. If allergies are suspected, it might involve intradermal allergy testing, like the skin prick tests in humans, or blood allergy tests, or very commonly for food allergies, a strict elimination diet trial for 8-12 weeks.
Wow, diet trials take a long time.
They do, but they're often the only reliable way to diagnose food allergy. If endocrine disease is on the list, you'll need specific blood tests to check thyroid function or screen for Cushing's disease. Skin biopsies, taking a small core of skin, are usually saved for more unusual, severe, or non-responsive cases, but they can be incredibly helpful, especially for ruling out autoimmune diseases or confirming deep infections and getting tissue for culture.
And I assume there are other things that can look like pyoderma but aren't. Differentials.
Oh, absolutely. Other parasitic infections like scabies, different fungal infections, certain autoimmune skin diseases like pemphigus foliaceus, cytology, and biopsies help differentiate those. Even severe allergic reactions without secondary infection can sometimes look similar initially. The sources note that superficial pyoderma in short-coated dogs can sometimes even mimic hives or urticaria because it just looks like sudden bumps.
Okay, quite a diagnostic journey potentially.
Yeah.
So let's say the diagnosis is confirmed pyoderma, maybe with a suspected underlying cause being investigated.
Yeah.
How do you actually treat the pyoderma itself? Sounds like it's more involved than just giving some pills.
It really is a combined approach, and you need to start treatment promptly. Most pets can be treated as outpatients at home, but those severe, widespread, deep pyoderma cases, they might actually need to be hospitalized for things like IV fluids and stronger antibiotics given by injection initially.
What about care at home? Things the owner needs to do besides meds?
Topical therapy is absolutely vital. Its importance is really stressed in the sources. Medicated shampoos are key. You need ingredients like chlorhexidine or benzoyl peroxide that actively kill bacteria and help flush out debris and crusts from the follicles.
So bathing is actually part of the treatment, not just for hygiene.
Definitely. Frequent bathing, maybe 2 or 3 times a week initially with the right shampoo, letting it sit on the skin for 10 minutes or so before rinsing it makes a huge difference. For deep pyoderma, the sources even mention things like whirlpool baths being beneficial to really help clean the wounds, encourage drainage, and improve circulation.
Interesting. Okay, medicated baths. What about the antibiotics themselves?
Right, they're usually the mainstay for clearing the infections systemically. The sources list common choices known to be effective against the usual suspect, Staph pseudointermedius. Things like cephalosporins, amoxicillin combined with clavulanate, clindamycin are often good starting points.
Are there antibiotics to avoid?
Yes, a crucial point from the sources is that Staph pseudointermedius is very often resistant to plain penicillin or plain amoxicillin, so just using those basic ones often won't work.
Good to know. And how does the vet choose which one?
Well, for a first-time, uncomplicated superficial pyoderma, they might make an empirical choice based on known susceptibility patterns. But, and this is critical for any infection that's recurrent, didn't respond to the first antibiotic, or is deep, the choice absolutely should be based on those culture and sensitivity results. You need to know exactly what you're fighting and what will kill it.
Okay, use the culture results for tricky cases. What about steroids, like prednisone? People often associate those with skin problems and itching.
This is a really, really important point the sources emphasize. Generally, you should avoid using corticosteroids just to treat the pyoderma itself.
Why is that? Don't they reduce inflammation?
They do, but that can be deceptive. They can make the skin look better temporarily by suppressing the inflammation, which might tempt you or the vet to stop the antibiotics too soon. Plus, steroids suppress the immune system, which can hinder clearing the infection and potentially select for resistant bacteria.
Okay. So they can mask the problem and maybe make it worse long term?
Exactly. Now, if steroids are needed to manage the severe itching from an underlying cause, like really bad allergies, then the sources say the antibiotics need to be continued for much longer and the skin needs very careful reevaluation before stopping them.
Got it. Any other treatment angles mentioned? Surgery, diet.
Yes, for those severe cases of skin-fold pyoderma, especially in breeds like bulldogs, sometimes medical management with topicals just isn't enough because of the anatomy. In those cases, surgical correction to remove or reduce the folds might be the best long-term solution alongside continued topical care. And of course, if a food allergy is proven to be the underlying driver, then adhering strictly to the prescribed hypoallergenic diet is absolutely fundamental to treatment and prevention.
Which brings us neatly to preventing recurrence. Because clearly, if it keeps coming back, just treating the infection isn't enough.
Absolutely. This is where long-term success lies. First, regarding the antibiotics themselves, the duration is key. The sources are incredibly clear on this. You must continue antibiotics for a minimum of 7 to 10 days after the skin looks completely normal, clinically cured.
A week to 10 days after it looks clear.
Minimum. So in practice, this often means a total course of 3 to 4 weeks for superficial pyoderma, and for deep pyoderma, you're looking at 6 to 10 rinse, maybe even longer.
Wow. That's much longer than people might expect.
It is, but stopping too soon is a massive reason for relapse and for breeding antibiotic-resistant bacteria. Finishing the entire prescribed course, even when things look good, is non-negotiable.
Okay, critical point on duration. But even that only deals with the current infection.
Yeah.
What about stopping it from happening again?
Right. And here, the sources are absolutely unanimous and emphatic. The single most crucial step to prevent pyoderma from coming back again and again is to identify and successfully manage that underlying cause.
Back to the detective work.
Always back to the detective work. If you don't get the allergies managed, or eradicate the mites, or treat the thyroid condition, or address the skin folds, the skin's defenses will remain compromised and the bacteria will just seize the next opportunity.
So managing the root cause is paramount. Are there other preventative strategies the sources suggest?
Yes, especially if the underlying cause can't be completely cured, like with some chronic allergies. Regular maintenance bathing with those medicated shampoos, maybe once a week or every other week, can help keep the bacterial numbers low and reduce flare-ups.
Okay, so maintenance bathing can help.
Using padded bedding can help prevent pyoderma on pressure points for big dogs. And for specific problem areas like chronic chin acne or those skin folds, regular use of topical antiseptic wipes, gels, or ointments can be really beneficial as a preventative measure.
What happens if pyoderma isn't treated properly or keeps coming back? What are the risks or complications?
Well, with deep infections particularly, there's always a risk, mentioned in the sources, of bacteria getting into the bloodstream. That can lead to bacteremia or even septicemia, which are potentially life-threatening systemic infections.
That sounds serious.
It is. And the other major complication, which we've touched on, is the development of antibiotic resistance. Every time bacteria are exposed to an antibiotic but not completely wiped out, there's a chance resistant strains will survive and multiply. This makes future infections much, much harder to treat, potentially leaving very few or even no effective options. It's a huge concern in both veterinary and human medicine.
Okay, so let's try and wrap this up,
Yeah.
summing up what the sources are really telling us. Pyoderma is common, especially in dogs. It's a bacterial skin infection. And this is the big, but it's almost never the real primary problem, is it?
Exactly. That's the core takeaway. Think of it as a signal, a red flag from the skin saying something deeper is wrong. That something is usually an underlying issue, allergies, parasites, hormones, conformation, you name it, that has weakened the skin's defenses and allowed the bacteria to take over.
And diagnosis involves recognizing those classic signs like the pustules and the collarettes, confirming the bacteria with cytology, definitely ruling out mites with scrapings, and maybe using cultures for the tough cases. But the real diagnostic challenge and the key to stopping the cycle is that relentless hunt for the underlying trigger.
That's the journey. Allergy testing, blood work, diet trials, whatever it takes. Treatment then needs the right antibiotic, chosen carefully, especially if it's recurrent, and given for long enough, crucially, well past the point the skin looks healed. And just as important is that topical therapy, the medicated bathing.
But ultimately, the sources are crystal clear. Treating the infection gives relief now, but finding and managing that underlying cause is the only way to truly prevent it from becoming a chronic, recurring nightmare.
That's the bottom line. Address the root cause for long-term control.
So thinking about this from the perspective of someone listening whose pet might be going through this, what does this deep dive really mean for you? Given this huge list of potential triggers the sources lay out, it could be fleas, it could be chicken in their food, it could be a thyroid problem you can't see, mites you didn't know were there, or even just the way your dog's adorable face is built.
Yeah.
How persistent are you and your vet prepared to be in playing that detective role to unearth the real reason behind recurrent skin infections?
Yeah, it highlights the complexity, doesn't it? But it also provides the map. Understanding that pyoderma is secondary is the first step on the path to figuring it out and hopefully achieving lasting relief for your pet. It takes commitment, for sure.